If you run a mid-size medical practice, there is a quiet reality you have probably noticed, even if it rarely gets talked about openly. The front office is rapidly becoming the most unstable and expensive part of your entire operation. This instability stems from systemic failure rather than the performance of your staff. The sheer volume of administrative tasks, complex insurance requirements, and endless electronic health record documentation has simply outpaced human capacity. We can see exactly how this burden is distributed in this chart. Medical office staff are now losing an average of 34 hours every single week to bureaucratic tasks. And it bleeds over to the clinical side too, with clinicians losing nearly 28 hours a week to that exact same paperwork. This massive time sink tracks directly with the physician burnout crisis. Right now, over 43% of doctors report experiencing burnout symptoms, specifically driven by this administrative overload and the hours spent catching up on documentation at night. When doctors spend their evenings on data entry, the resulting administrative overload threatens patient capacity and the long-term survival of the practice. The traditional reflex is to try and hire your way out of the problem, but simply adding more administrative bodies to the front desk is failing, largely because medical assistant and front office roles suffer from some of the highest turnover rates in the industry. Look at the exact financial penalty of that turnover. Between recruitment, onboarding, and the inevitable drop in productivity while training a replacement, losing a single front desk worker costs a practice up to $12,000. Now compound that penalty with rising market rates. Standard wages for administrative support roles have climbed by over 50% in less than a decade. The math simply does not work anymore. Medical practices are caught in a staffing spiral where surging labor costs and constant turnover actively drain revenue, while the core operational bottleneck remains completely unresolved. To break this cycle, the operation requires a structural fix, physically and systematically separating your clinical workflows from your administrative workflows. This division is achieved by outsourcing to specialized virtual medical assistants. Instead of piling more paperwork onto your in-house staff, you migrate complex, non-patient-facing tasks entirely out of the physical office environment. A virtual assistant operates through a secure data bridge directly inside your electronic health records, managing scheduling and billing. Because they are specialists, efficiency gains are immediate. A complex prior authorization taking a front desk generalist 2 hours manually is completed in under 10 minutes. By offloading these screen-heavy tasks to a dedicated remote team, you instantly clear out the phone queues and eliminate the constant workflow interruptions that degrade the patient experience. Scaling administrative capacity effectively relies on the seamless integration of AI automation alongside a human virtual assistant team. Document intelligence tools automatically read and categorize incoming paperwork. This removes manual sorting, allowing the human assistant to process patient files significantly faster. At the same time, AI error prevention systems actively monitor the specific payer mix of your practice. They learn from past rejections and apply automated safeguards to catch repeat billing errors before the claims are ever submitted. Because this model relies on a structured outsourcing partner, you gain strict institutional redundancy. The agency handles HIPAA compliance, maintains security certifications, and provides backup staff coverage, entirely eliminating the risk of a single point of failure when someone calls in sick. AI serves as a force multiplier for human accountability, ensuring consistent quality control and uninterrupted operations regardless of local market conditions. When we look at the hard financial return on investment, the cost advantage of the virtual assistant model is highly specific. This ledger shows the annual burden of an in-house administrative employee. Adding salary, benefits, taxes, turnover, and overhead, a local hire costs over $60,800 a year. Compare that with a dedicated virtual assistant. The all-inclusive cost is $21,600, a 64% cost reduction. That $40,000 in annual savings per role represents highly liquid capital. It can be immediately reinvested into expanding clinical capacity, upgrading practice equipment, or increasing provider compensation. The true operational yield is measured in time, with practices consistently reclaiming 8 to 12 hours of clinical staff capacity every week, reversing the bureaucratic bottlenecks that slow down care. The implementation process is designed to be frictionless. A medical practice can launch a fully compliant virtual assistant pilot in as little as 48 to 72 hours, without being locked in to any long-term contracts. Thriving in the modern healthcare landscape requires treating administrative burden as a solvable engineering problem. By fixing the structural deficit in the front office, providers can finally return their undivided attention to patient care.